far, you've heard some interesting arguments this evening from both sides of our debate. However, there is still more to be said about this issue. The benefits of implementing a government-run public option healthcare plan in Indiana are too significant and far-reaching to ignore. First, let me remind you that our plan is not similar to Massachusetts' plan in many ways. First of all, nobody in Indiana will be required to buy health insurance. It will be completely their option, and if they choose not to buy it, then they will not be forced to buy it. Second of all, the state will not be paying for this insurance. This insurance is a public option, and therefore, people will actually be paying for this insurance, and therefore, the revenue for this will not come out of state coffers. Additionally, those against public option health insurance will tell you that implementing such a plan would cause your taxes to skyrocket, driving up the prices to many families who are already insured. However, according to a report by the Indiana state government in 2005, each privately insured family paid an additional $953 in hidden taxes to cover the cost of the uninsured. In 2010, premiums are expected to rise $1,494 to account for the cost of these uninsured. Therefore, even those who are already privately insured are still paying for those who can't afford to buy insurance. So, introducing a plan that will make healthcare more affordable to thousands of people in the state, and therefore increase insurance coverage by thousands, will only help to lower the cost of healthcare. Additionally, Indiana is already spending $5.25 billion a year on Medicare, which is already a good deal more than the projected $1.2 billion that we will spend on this public option plan. Furthermore, by choosing a public option healthcare plan for Indiana, this in no way means that healthcare would be taken over by the government. We're not talking about socialized medicine here. No Hoosier who has existing health insurance will be forced to abandon it. They will be able to keep their private insurance should they wish to do so. Much as Americans have the option to choose between a public and private university, so would we be able to choose between private and public health insurance. And just as public universities are both cost-effective and a good educational option, so would a public option healthcare plan simply improve Indiana's current system by offering lower prices through competition. Most importantly, a public option healthcare plan would ensure that all Hoosiers have the means and ability to purchase adequate and affordable health care. By offering a lower-cost healthcare option, a public option plan would drive competition by forcing private insurance companies to lower costs and up their benefits in attempts to be a viable alternative to government insurance. Those against the public option plan will also argue that public option would lead to year-long waiting lines and perhaps an inability to get the treatment you need. Under no circumstances will a public option plan sacrifice the health of Hoosiers in order to cut costs. Hoosiers under the public option plan would show no decrease in quality or duration of life. Many Americans, even those with private insurance, don't have this guarantee due to the insurance company's predisposition to deny procedures categorized as experimental. The most important thing to remember is that private insurance is by no means a cure-all. The cost of even basic private health care in Indiana has risen exponentially in the past decade and continues to grow, making medical care for Americans not working for large corporations expensive at best and impossible to afford in many cases. According to a 2007 report by the Kaiser Foundation, premiums for family health care coverage increased 78% since 2000 and are expected to rise more than 15% for employees in 2010 alone. Health insurance premiums for Indiana working families have increased 83% from 2000 to 2007. Meanwhile, WellPoint, which is one of Indiana's largest insurance firms, is raising premiums by as much as 39% in its major markets, Indianapolis being one of these markets. Healthcare is a right, not a privilege, and the fact that an increasing number of Americans have been unable to afford even basic healthcare coverage is ludicrous. Rising healthcare costs will simply continue to compound the huge problem already existing in America. An estimate by the U.S. Census Bureau indicated that 47 million Americans went without healthcare insurance for the entirety of 2008. A 2009 study commissioned by Families USA showed that 86.7 million Americans, or roughly one-third of America's total population, were uninsured at one point between 2007 and 2008, with 3/4 of these people being uninsured for 6 months or more, and 2/3 being uninsured for more than 9 months. The difficulties of affording health insurance have been compounded by the financial crisis. As more and more Americans become unemployed, for example, the current unemployment rate is 9.7%, 2/3 of unemployed adults lacked health insurance, according to a December 2009 report released by the Centers for Disease Control and Prevention. The largest factor associated with rising healthcare costs in Indiana is the intrinsic inefficiency of a private health insurance industry. Recent years have proven that a private insurance system simply doesn't work, despite the healthcare companies' insistence on the merits of such a system. Costs have continued to rise despite a lack of government involvement, and an increasing number of Americans become uninsured each year. The fact of the matter is that when every single company adopts the same policies, such as a profound reluctance to insure those with pre-existing conditions, for example, competition becomes non-existent and Americans suffer. Competition also suffers as insurance companies continue to buy each other out, creating regional monopolies. Blue Cross Blue Shield, in a massive Midwestern buyout, recently bought Unicare Health Insurance. This buyout is just one example of the increasing number of regional markets that are becoming less and less competitive due to the growth of monopolies and more similar insurance policies. In a 2007 report by the American Medical Association, 2 health insurance providers, Blue Cross Blue Shield and WellPoint Incorporated, combined to control 92% of the healthcare market in the Gary metropolitan area. In Anderson, Indiana, WellPoint and United Healthcare Group, Inc. combined to control 89% of the market. Among all 50 states, Indiana places 36th worst among states with the least competitive private health insurance systems. Letty Oliver of the Central Indiana Central Labor Council said, quote, "There is no real choice or competition in the private health insurance market, and only giving everyone the option of a public health insurance plan will guarantee we get quality, affordable health care we all can count on this year. A public health insurance option will force private health insurance companies to control costs, guarantee quality, stop hiding what they will and won't cover, and put people's health before corporate profit," unquote. This is why a public option plan is not only necessary in repairing America's broken healthcare system, but it's also decidedly more competition-driven than the current healthcare system. A government-run insurance provider will be able to offer lower prices and more efficient care, and would therefore reinvigorate competition in a stagnant healthcare system where companies are more focused on profit margins than on the care their clients are being provided. In conclusion, a public option healthcare plan would mean smaller costs, increased efficiency, and a definite improvement in competition between insurance companies. Health insurance is a right, not a privilege, and this is why a government-run public option health insurance plan for Indiana is absolutely beneficial and, above all, essential. Thank you.
In this proposed system, you will have to take money from the upper and middle class through substantial taxes and force medical institutions and professionals to absorb even more costs than they already do. How can you support this redistribution of wealth under the Constitution of the United States? Furthermore, if you're making it more difficult for people in the medical profession to make a living, what incentives do you propose to ensure that current doctors stay in Indiana and that the best and brightest continue to become doctors?
Well, first of all, I'm not exactly sure where you got those statistics because in my research at least, I've never come upon any of those statistics. And let me just emphasize that even without implementing this public option healthcare, you are still paying for those who are uninsured. You are still paying hidden taxes, almost $1,500 a year, to be exact, to pay for the cost of those uninsured. And let me also emphasize that under this public option plan, people would be paying for this plan. It would act just as a private insurance company does today. People pay for it themselves. It's just like a more affordable private insurer because it's funded by the government. So, in conclusion, people will still be paying for this, and therefore, this money will not be coming out of state revenues. The state will not be paying for it. Taxes will not rise. Taxes won't rise. Thank you.